So first of all, let's look at the attachments of external oblique. So we looked at the attachments of rectus abdominis. Rectus abdominis was having its origin from the pubis and insertion onto the thoracic cage, whereas the external oblique muscle will be the opposite of that. That is, the origin of external oblique muscle is from the thoracic cage, from the lower 8 ribs, the xiphoid process, and the linea alba. The origin I've labeled in red. Whereas the insertion of external oblique will be onto the pelvis. Insertion is onto the ventral segment of the iliac crest, the pubic crest, and the pubic tubercle. If it helps in your memory, you can just remind yourself about how the external oblique is taking origin from the thoracic cage and the insertion onto the pelvis. Now, the insertion of external oblique aponeurosis is onto the pubic crest and tubercle. Okay, that is how the muscle fibers will get inserted. Please be thorough with these attachments of each of the flat muscles of the abdomen. And the nerve supplies by the lower 6 intercostal nerves. Each of the flat muscles have a similar nerve supply, so it will be a little easier for you to remember. Now, the external oblique aponeurosis has certain modifications within the body that is of great importance for you. One of the modifications of external oblique aponeurosis is the inguinal ligament. So can you tell me what are the attachments of the inguinal ligament? It is shown in this diagram. This is the extent of the inguinal ligament. It is actually formed by the thickening of the inferior border of the external oblique aponeurosis. What are the attachments of the inguinal ligament? Yes, anterior superior iliac spine and pubic tubercle. Good. There are other modifications as well of external oblique aponeurosis. One is the lacunar ligament. The lacunar ligament is triangular in shape. The apex is at pubic tubercle, whereas the base is free. The base of lacunar ligament forms a boundary of the femoral canal. If you refresh your memory regarding femoral sheath and the femoral canal, you'll remember that the free margin of lacunar ligament is also present at the boundary of the femoral canal. Finally, there is one more extension from the lacunar ligament, which is known as the pectineal ligament of Cooper. Pectineal ligament is attached to the pecten pubis. So you have to know each of these modifications of the external oblique aponeurosis. Another modification is the superficial inguinal ring. It's labeled. This is a triangular opening within the aponeurosis. And if you look carefully, the structure that passes through superficial inguinal ring is the spermatic cord. So the testis is present within the scrotum, and the vas deferens travels from the testis to the pelvic cavity. You know that basic anatomy. So as the spermatic cord is passing into the anterior abdominal wall and finally into the pelvic cavity, the superficial inguinal ring serves as an opening. Also, the spermatic cord is covered with a fascia known as external spermatic fascia. This is derived from the external oblique aponeurosis. So when you go through these diagrams, you can get an idea that the areas that are colored in whitish gray color is actually the external oblique aponeurosis in the region of abdomen. And you can see how that is getting extended into the various regions that we have mentioned. So all of you, please learn this list today. What are the structures derived from external oblique aponeurosis? As always, in any topic of anatomy, first learn the diagram, and then it will be easier for you to remember the structures when you correlate. Now let us look at the internal oblique abdominis. Okay. Now the internal oblique takes origin from the inguinal ligament, the iliac crest, and from a fascia that is present on the posterior abdominal wall, which is known as lumbar fascia. So just think about its origin. Okay, it's from the region of the inguinal ligament and the iliac crest. Okay, this is the origin from the inferior and the lateral aspect of the abdomen. Whereas the fibers will run towards the midline. So the insertion of internal oblique muscle is to the linea alba and in the midline to pecten pubis, pubic crest. And finally, there's also an insertion to the costal cartilages. But this is only to the 8 to 10 ribs and their corresponding costal cartilages. Please write down these attachments as a table. It will help you to remember it better. So the nerve supply of internal oblique abdominis is by the lower 6 intercostal nerves, the iliohypogastric and the ilioinguinal nerves. What are the structures derived from the internal oblique muscle? If you can see in this diagram, these are the fibers of internal oblique in the abdomen. And we can see that a few muscle fibers are traveling along the spermatic cord. Few muscle fibers derived from internal oblique will cover the spermatic cord and also give a covering for the testis in the scrotum. That is called the cremaster muscle and cremastric fascia. You may have learned about cremastric reflex in examination of the nervous system in physiology. If so, please keep in mind that the cremastric muscle is derived from the internal oblique muscle. Apart from this, there are two more modifications or two more structures derived, that is the conjoint tendon. I'll show you the diagram. Also, the internal oblique aponeurosis as well helps in the formation of rectus sheath. So conjoint tendon is a thickened area which is formed towards the midline in the lower aspect of the anterior abdominal wall. The word conjoint means formed by the union of more than one structure. The conjoint tendon is actually formed by both the internal oblique muscle and the transversus abdominis muscle. You can see two muscles here forming a thickened tendon in the midline. This is another picture to show you the Superficial most layer is the external oblique aponeurosis. Deeper to it is the internal oblique muscle, and the deepest muscle here, the flat muscle, is the transversus abdominis. So you can see that both the internal oblique and the transversus abdominis muscle together will form the conjoint tendon towards the midline. Keep this in mind. This has clinical importance when you are learning about the inguinal canal. From the diagram itself and from the name, you can see the direction of fibers. It is horizontally oriented. So the origin of transversus abdominis, okay, it is from the costal margin. So it's from the lower 6 ribs and costal cartilages, as well as from the iliac crest and inguinal ligament. From the posterior aspect, there's an origin from lumbar fascia as well. Then the fibers are oriented horizontally and finally get inserted into pubic crest, pecten pubis, and in the midline to linea alba. From what we have discussed, you can see that the linea alba, it is a midline structure extending from pubic symphysis to xiphoid process, and it gives attachments to each of the 3 flat muscles of the abdomen. The linea alba is an important structure. Now you have to tell me, what is the nerve supply of transversus abdominis? It is the same nerve supply as internal oblique abdominis. So please tell me the nerve supply.
Iliohypogastric ilioinguinal nerves.
Yes, good. Along with that, there's one more group.
Thoracic nerves.
Yes, which thoracic nerves?
T7 to T12.
Yes, good. Good answer. Is lateral flexion of the abdomen, or more specifically, you can say it as lateral flexion of the vertebral column, is brought about by unilateral contraction of the flat muscles of the abdomen, or lateral flexion of the trunk, if you will. When both sides are contracted, when there is bilateral contraction of the flat muscles of the abdomen. Okay, this is the movement that occurs. So can you describe this movement? Is it flexion? Is it rotation? Is side to side rotation of the trunk. So finally, the layer of the anterior abdominal wall, which is fascia transversalis, is the fascia which lines the interior of transversus abdominis muscle. So you've had a look is the rectus sheath. The rectus sheath is an aponeurotic sheath which covers the rectus abdominis and the pyramidalis muscles. It is formed by the splitting of aponeurosis of the 3 lateral muscles of the abdomen. In this diagram, you can see this is the external oblique muscle and its aponeurosis towards the midline, which will enclose the rectus abdominis. So let's see the details of how the rectus sheath is formed. The parts of the rectus sheath are the anterior wall, which is visible when you reflect the skin and the superficial fascia in the anterior abdominal wall. Deeper, there is the posterior wall. Towards the, we're talking about one side. This is the rectus sheath on the right side, the covering rectus sheath. The medial margin of the rectus sheath on one side will be in the midline. So what structure forms the medial margin of the rectus sheath on one side? Yes, what is the structure in the midline? Yes, the linea alba is what forms the medial margin. Good. Now the lateral margin of rectus sheath covers the lateral margin of the rectus abdominis muscle. So do you remember from surface anatomy, what is the name of the linear ridge which forms the lateral margin? Yes, good. Some of you are very prompt to answer. The lateral margin is formed by linea semilunaris. We are going to learn the formation of rectus sheath at 3 levels. Okay, the rectus sheath formation is slightly different at 3 different levels. So one is marked by the bracket here, that is above the level of the costal margin is the first point where we are going to learn about the layers of the rectus sheath above costal margin. The second point where we learn the anatomy is between the costal margin and a point between the umbilicus and pubic symphysis. Okay, so that is represented by the blue bracket. This wide area is where the rectus sheath has a different anatomy than the first area. But when you're drawing the diagram, we'll be drawing the diagram at this level. So the brackets actually represent the wide area where the rectus sheath has a particular anatomy, whereas these transverse lines are the cross-section levels at which you are going to learn the diagram to learn the anterior and posterior walls of rectus sheath. So the third level where you learn about the rectus sheath is from a point midway between umbilicus and pubic symphysis up to the level of pubic symphysis. This is a diagram that you have to learn from your textbooks. This is the cross-sectional view of the anterior abdominal wall. We are looking only at the flat muscles of the abdomen here laterally. In the midline, this is the rectus abdominis muscle. This is the sternum. So we are going to see what are the structures which will cover the rectus abdominis muscle, what forms the rectus sheath anteriorly and posteriorly. Now you can see the diagram, there are 3 subdivisions. First of all, above the level of costal margin, look at the formation of rectus sheath. The rectus sheath is formed by the aponeurosis of external oblique muscle alone. That the posterior wall of rectus sheath is deficient at this level, and the rectus abdominis muscle will be resting on costal cartilage 5, 6, and 7. If you learn this diagram, you can write it in your own words. What is the anterior wall and the posterior wall? Now we will look at the formation of rectus sheath at the level B. Here, the anterior wall is formed by aponeurosis of external oblique, plus there is a contribution by aponeurosis of internal oblique muscle as well. If you look closely at the aponeurosis of internal oblique muscle, internal oblique muscle aponeurosis will actually split into 2 layers. What is represented in blue color is called the anterior lamella or the anterior layer of internal oblique aponeurosis. And what is labeled in red color is the posterior lamella or posterior layer of internal oblique aponeurosis. So at the level B, anterior wall of rectus sheath is formed by external oblique aponeurosis and by anterior lamella of internal oblique muscle. Whereas the posterior wall of rectus sheath at level B is formed by posterior lamella of internal oblique and aponeurosis of transversus abdominis muscle. What about the rectus sheath at the level C or at the third level? At this level, you can see the aponeurosis of all three flat muscles of abdomen will form the anterior wall, whereas posterior wall of rectus sheath at this level is deficient. It is formed by fascia transversalis alone. Here's the posterior view of the anterior abdominal wall. We can see there is a line at the rectus sheath, an arc-like line at which the rectus sheath is deficient at the level C. So this line is called arcuate line. The inferior epigastric artery enters the rectus sheath. So contents of rectus sheath. The muscles are the rectus abdominis and the pyramidalis. Vessels are superior epigastric and inferior epigastric vessels. And the intercostal nerve 6 to 11 and subcostal nerve as well enters into the rectus sheath. You have to learn these contents as well. Does anyone know superior epigastric artery is a branch of which artery? Internal thoracic artery gives rise to the branch superior epigastric artery. Very good. Can you tell me what was the neurovascular plane in the thoracic wall? The neurovascular bundle was present in between which two structures in the intercostal space? Yes, between the internal intercostal and the innermost intercostal muscles. Good. So in the abdomen, the neurovascular plane is in between the internal oblique and the transversus abdominis muscle. Keep that in mind. In dissection also, you will be seeing the nerves and vessels in between these two muscles, internal oblique and transversus abdominis. Arterial supply of the anterior abdominal wall, you can just learn it on your own. Superior epigastric, branch of internal thoracic. Inferior epigastric artery, which is the branch of external iliac. These are the two most important arteries. There are smaller branches as well, such as branches of posterior intercostal arteries. The superior epigastric vein here, superior epigastric vein, and laterally there is a thoracoepigastric vein. This thoracoepigastric vein finally drains into the axillary vein, and the inferior epigastric vein finally drains into great saphenous vein. The lymphatic drainage of anterior abdominal wall, it is different, superior to the umbilicus and inferior to the umbilicus. Superior to the umbilicus, the lymph drains into the axillary lymph nodes, whereas inferior to the umbilicus, lymph drains into superficial inguinal lymph nodes. Because the lymphatic drainage is into different sites, superior and inferior to the umbilicus, the region of umbilicus is called the watershed line. Watershed means a demarcation between two rivers. So umbilicus is known as watershed line regarding the lymphatic drainage. As this venous drainage that we spoke about, the epigastric veins, belongs to the circulation called systemic circulation. In the abdomen, there's another component for the circulation called the portal circulation. That is the blood circulating through portal vein within the abdomen. It is slightly different than the rest of the circulation. So there is a set of veins known as para-umbilical veins. Okay, you can see it here in the diagram, radiating from the umbilicus. Para-umbilical veins, they are actually communications between the systemic vein and the portal vein. If the portal circulation is affected, the veins around the umbilicus get dilated, and this condition is called caput medusae.